Pacific College is a magnet for interesting people.
I'm a singer and a performer.
I started out years ago as a flight attendant.
I was a modern and ballet dancer.
I have been a nurse for 33 years.
I've been a licensed acupuncturist for over 2 decades.
I graduated from Pacific College in 2009.
I am an immigrant. I'm from the island of Cyprus. I'm a war refugee.
My background is in library science. I studied in England and in a program from the European Union.
I have a graduate degree from Harvard in educational psychology and undergraduate degrees from the University of Pennsylvania and another graduate degree in computer science from Northwestern.
I was a student of classical piano in secondary private study in the conservatory.
We are very fortunate as leaders, faculty, staff, and students at Pacific College because we really are fundamentally engaged in transformative work.
Many schools view complementary and alternative medicine as an add-on to their healthcare practices, their healthcare education, but here at Pacific, it's integral to it.
A vision of the founders of Pacific College was always to have an effect on our culture through Chinese medicine.
We have 350 million people in the United States, and Pacific wants to be a beacon of clarity around the future of healthcare and that transition to the future.
The really beautiful thing about practicing this medicine and receiving this medicine is we're able, one person at a time, to create that harmonious balance within.
We have probably the largest network in the country of acupuncturists, massage therapists, holistic health professionals, and they can find each other, support each other, mentor each other, and hire each other.
The student body at Pacific College of Health and Science are anywhere from 19 years old, graduating from high school, or they are people who have already graduated college.
We have many retirees who are looking to pursue their deferred dreams.
I actually met somebody who's 75, and she's going to school with her daughter, who's in her 40s.
They're working mothers and fathers, so you can see how diverse this really is.
We support students who are managing their busy life by introducing support services throughout the city and then just being encouraging and really trying to stand in the gaps that they may have to help them reach their goal.
We are part of a vibrant college community that includes individuals being educated in traditional Chinese medicine, acupuncture, massage therapists, people who do body work and energy work.
Integrative medicine has always been part of the training at Pacific College.
Emotions actually produce chemicals and transmitters and nerve impulses that actually affect the way we feel, can affect our disease susceptibility, can affect the way that we experience symptoms, and conversely, looking at changing the way we feel and perceive things can actually have a significant impact on health.
I've spoken with patients in tears about the care that they received here and the magic that was performed on them and healed them. And so that's one of the things that really keeps me going and committed to the mission.
We have an array and variety of resources that's really hard to replicate anywhere else. We have the resources of the libraries on all the different campuses.
We have a very large collection of print books. In New York alone, we have 7,000 books.
I chose to be part of the Pacific College family because I realized that everybody was true to the mission. It's an authentic place and serious about cultural diversity.
Health equity matters tremendously for the Pacific College of Health and Science.
Health equity means equal access to healthcare by all.
It also means respect, so that when we provide healthcare for a diversity of populations, that we're treating each of those populations with respect, with dignity, and in appropriate ways.
Health equity is what we as clinicians and public policy advocates have to continually fight for.
We provide 50,000 patient visits around the country. So we're giving low-cost access to high-quality healthcare services. No matter what race or socioeconomic background comes into a healthcare setting, they're being addressed as a whole person.
We not only infuse compassion within each program, but we assure that every graduate is out there in the world as a compassionate individual, positively contributing to society.
We help our graduates determine what it is that they want to do and what success means to them.
Our alumni have careers that really span the breadth of healthcare. Many go on to work in hospitals, some become researchers, others become faculty members or authors.
My favorite thing about working at Pacific College is seeing the light go on in the eyes of the students and the graduates.
Helping people pursue their hopes and dreams.
Helping students because they really have a lot of passion of what they're studying.
Advocating for the students and the people who care about the same things that I do.
It is not uncommon for me to hear from our nursing students, I found my tribe.
You are part of the medicine. We do believe that we're going to help people improve lives exponentially.
Ultimately, you want to do something meaningful with your life, right? You want to do something where you make a difference in the world.
And at the end of the day, it's all about the students. So really the decisions aren't that hard if we always keep that in mind.